Hi guys, welcome to the next episode where we have Dr. Prince with us.
Hello.
And today we are going to speak about fractures. So, Dr. Prince, how do fractures happen most generally?
Generally, fractures can happen with any kind of injury like road traffic accidents, sports injury, any fall from height. Any injury can lead to a fracture. Weak bones generally tend to break easily or fracture easily.
And is there a way to prevent it?
Yeah, to keep our bones and joints strong by taking regular supplements of vitamin D and calcium, to strengthen our muscles around the joints, to prevent falls wherever possible.
Sure. So let's just answer some most Google questions about fractures. So the first question is, what is a hairline fracture?
Okay. So hairline fracture is a mild form of fracture where there is no displacement, there is no angulation. On X-ray it appears like a unicortical or a hairline kind of thing, so it's a very minor kind of fracture.
Okay, let's move to the next question. What is a stress fracture?
Stress fractures generally happens due to repeated stress or repeated trauma, generally seen in athletes or sports person or soldiers, where they do running and vigorous sort of exercises, which leads to weakening of bones and ultimately stress fracture happens. The common sites for stress fractures are metatarsal bones and tibia.
Okay. So, do fractures take time to heal?
Yes, the normal duration for fracture healing is generally 4 to 6 weeks in normal kind of fractures, maximum up to 3 months. Depends on type of fracture, depends on type of bone, depends on osteoporosis and multiple other factors.
And I've heard even fractures, the injury of fractures can remain throughout the life with you.
No, nothing like that. Generally, in three months time, fracture which is a broken part of bone, it heals.
Yeah, that's good. Let's move to the next question. What is an open fracture?
Okay, so coming to open fractures, is a type of fracture where the fractured bone gets exposed to the external environment. It comes out, breaking the barrier between the bone and the environment like skin, muscles, soft tissues, periosteum. So it makes the bone exposed to the external environment and more susceptible for infection.
Okay. And how do we heal fracture faster?
So again, coming to this question, fractures generally heal in a span of 4 to 6 weeks time, maximum up to 3 months time. For fracture healing, we need to take regular supplements of vitamin D and calcium. We immobilize the bone, one joint above and one joint below with a plaster, so that no movement happens at the fracture site, and fractures heal easily with the regular supplements.
So, can fractures heal naturally?
Yes, fractures can heal naturally, but there is a tendency of the fracture to heal in a malunited position, or there is a chance of non-union if the movement is regularly happening at the fracture site. So fracture is definitely going to heal, but it might heal in a malunited position.
Okay, that's great. And what are the common causes of fractures?
Common causes of fractures are fall. Whenever there is an injury, it has a tendency to cause a fracture. Any sports injury can lead to a fracture. Any road traffic accident can lead to a fracture. So to avoid that, you need to regularly strengthen your muscles, regularly keep your bones healthy by taking regular vitamin D and calcium supplements, and avoid injuries wherever possible.
Is there a particular pulse or a particular food that we should avoid during a fracture?
We should avoid smoking and drinking whenever there is a fracture for better healing, because smoking doesn't allow fracture healing to go well. It reduces the blood circulation around the fracture site, and so the fracture doesn't heal well properly.
Smoking and drinking should be avoided.
Yes, actually.
Without a fracture even also.
Yeah.
Okay, thank you guys.
Yeah, thank you.
So guys, for any queries, please contact HexaHealth for any type of fracture queries or any other help. And also, don't forget to subscribe to our channel.
Thank you.